The medical system here in South Korea has been in crisis for over 2 weeks now, as the junior doctors continue refusing to return to duty over the medical school quota hike. Now, steps to suspend their licenses are in full swing, and we saw President Yoon himself addressing the crisis earlier this week. We have our top office correspondent Oh Soo-young to talk about more about the latest situation. Welcome, Soo-young.
Hi, Tammy. It's great to be here.
So, Soo-young, for our viewers, let's do a recap of what's been going on. What are the main arguments between the government and the junior doctors?
Right, well, starting with the government, the administration would like to increase the number of medical school students admitted each year to universities in order to address the severe shortage of doctors in hospitals throughout the country, particularly in regions outside Seoul, as many flock to the capital to get quality healthcare. And now, of course, there are many hospitals in Seoul, but that's still a lot of patients for a limited number of doctors who say they are also underpaid, as essential medical services are partially subsidized by the national healthcare insurance. That's why we've been seeing more and more medical school graduates setting up cosmetic surgeries and going into areas like dermatology. For instance, that's some of the examples, as they're non-essential services, and that means they can charge whatever price they like. So to increase access to quality healthcare, particularly to address the rapidly aging population, which will require many specialists in areas like neurosurgery, the government says it will expand the number of additional students to medical schools by 2,000 next year to reach 10,000 by 2035. Now, this has been met with fierce opposition among trainee doctors who have flat out rejected the number. The first and foremost reason being that they believe the number of doctors are already substantial. They think there are already enough qualified doctors. Also, they're raising an issue with the quota of medical school students entering universities, saying that it's going to lower the quality of education if the number is inflated. They're calling on the government instead to address the compensation system for doctors to be paid more for essential services, and also to improve protection measures against lawsuits. But the government is standing firm on adding 2,000 students as the bare minimum. According to data from the Organization for Economic Cooperation and Development, South Korea falls below the average 3.7 doctors per 1,000 people, only having 2.6 doctors per 1,000 people. Also, South Korea has an average 77 medical students per university, comparing to countries like Germany or Britain, which have over 220 medical students per school. In fact, on Thursday, the Education Ministry said that 40 universities with medical schools, including Seoul National University, they've applied to enroll 3,401 extra students for the academic year of 2025. So that actually tops the government's target number, clearly showing that there's room and demand for medical trainees in the country, more medical trainees in the country. But that, of course, that hasn't gone down very well with the junior doctors.
Well, regardless of all these facts, though, neither side is budging.
That's right, Tammy. So without a clear middle ground, or any middle ground really, by Wednesday, over 11,200 doctors had not reported for duty, accounting for 91% of all junior doctors at 100 teaching universities in South Korea. Also, around 90% of prospective interns at major hospitals in Seoul, who were supposed to start earlier this week, reportedly withdrew from signing their training contracts. Around half of the surgeries resultantly scheduled at some major hospitals now have been cancelled since last week, according to the Health Ministry. Now, in the past, the government had always backed down when doctors rose up in fear of such a medical crisis. For instance, in 2000, doctors went on strike to protest the creation of a division of medicine in schools, which resulted in the government actually cutting the number of medical students by 351. In 2020, attempts to restore the capacity, that was met with similar collective action by medical students amid the height of the coronavirus outbreak. So this time round, the government is adamant that the country can no longer wait for reform, and it's not going to accept any illegal collective action, as under the South Korean law, doctors aren't allowed to go on strikes.
And as long as the standoff stretches on, public health is in crisis mode. And it seems like the president himself tried to break the impasse, right?
That's right, Tammy. So as the illegal collective action approaches its third week, it seemed that the president himself, he felt that enough was enough after hearing about ambulances not being able to find emergency wards, surgeries being delayed or even cancelled, and all these unnecessary deaths. President Yoon on Wednesday deemed the collective action a dereliction of duty by the doctors. He said that the government will not tolerate actions that violate people's right to life and health under the Korean Constitution.
의사들의 집단 행동은 스스로 책무를 져버리는 일이며 자유주의와 법치주의의 근간을 흔드는 것입니다. 국민의 생명을 볼모로 하는 불법적인 집단 행동에는 법과 원칙에 따라 엄중히 대응할 수밖에 없습니다.
Yoon said, as the state is constitutionally obliged to protect the lives and health of its citizens, doctors are licensed to carry out this important public duty. He rejected claims that suspending medical licenses for an estimated 7,000 partaking in the strike infringes on their rights.
국가가 의사에게 면허를 부여하고 법에 따라 엄격하게 관리하는 것은 국민의 생명과 건강을 보호하기 위한 일입니다. 그러기에 의사의 자유와 권리에는 책임이 따르는 것입니다. 국민의 생명권을 침해하는 불법적인 집단 행동은 절대 허용될 수 없습니다.
So all these suspension measures, what happens to the doctors?
Well, obviously it means that they can't practice medicine during the time of their suspension, and the duration of the suspension, that could set back the time that they are able to qualify for their specialist certification. So it could take longer and delay career advancement, of course. Now, that's if they want to go back to work. If that's not the case, then that could lead to more serious repercussions.
If they continue to defy the government and do not return to their workplace, and also do not treat patients, they can actually be prosecuted as a result. And if they are found guilty of a criminal offense that ends up in a prison sentence, even if it's a suspended sentence, they could actually have their licenses revoked, not just suspended, which means that they will be without a license and they wouldn't be able to practice at all.
Well, in the meantime, what are some of the measures being carried out?
Well, a couple of things, Tammy. So the government's number one goal really is to stabilise the system, keep emergency care and essential services operating. Measures include increasing the roles of nurses to support emergency care, including carrying out CPR and injecting medication. Military hospitals, they'll also be deployed, and also the government is going to support labour costs involved in hiring extra personnel. Also, the so-called Big Five, or the 5 major hospitals in the country, they're going to focus on treating seriously ill patients, while the local general hospitals, they'll take the role of tending to those in less critical conditions. Now, to help support these efforts, the government has set aside some $96 million in contingency funds.
Well, another interesting point is the role of the nurses. Let's talk about that.
Yeah, very interesting indeed. So from Friday, professional and designated nurses, they can temporarily perform CPR or administer emergency medication in emergency situations. Some can even draft medical records, requests for transfer of hospitals, surgical consent and prescribed medication, which can only be done by doctors under law. In particular, thousands of physicians' assistants or PA nurses, they've for years been carrying out substantial tasks in the operation rooms due to the shortage of doctors. However, Doctors Group they've been opposing having these PAs, nurses' roles officially recognised, as this could potentially mean competition if they set up their own clinics, for instance. Thus, mobilising designated nurses under the government's emergency guidelines, that could potentially lead to change as part of an overall medical reform that the Yoon administration believes is sorely needed. President Yoon himself on Wednesday said that the government will carry out fundamental reforms of the medical delivery system, changing the staffing structure and actively utilising nurses like these PA nurses.
Well, we'll have to see where things lead for now, but a breakthrough is very much needed.
Yes, I agree, Tammy.
All right, Soo-young, thank you so much for the report today.
Thanks so much.